The mild winter rain was falling. Nobody was aware that all the moisture was causing something to grow underground. A fungus. There was severe drought, climate change in full force. The fungus began to change form. Nobody knew. Construction was set to begin. The team worked hard. The air was dry and the environment was dusty. The winds were blowing and picking up dust. But people continued on as usual. The construction was complete, but some of the team didn't feel so great.
I've been so sick. A cough that won't go away, chills, neck pain. Haven't been able to work. Can't pay my bills. I wonder if that construction job caused my cough. The flu medication I got from the doctor aren't working. Working in all this dust may be an occupational hazard.
You work in construction. We've had a terrible drought, and your test results show coccidioidomycosis. Looks like you have valley fever.
Cocci presents symptoms in only 40% of those who get it. It's especially harmful for pregnant women due to relative immunodeficiency.
Coccidioidomycosis, valley fever, is caused by a fungus. It thrives in dry desert soils of southern Arizona, Nevada, northern Mexico, and California's San Joaquin Valley. The fungus can also be found in New Mexico, Texas, and parts of Central and South America.
The fungi spores grow during the times of rain. If arid conditions follow, such as drought, wind, and disruption of land, spores are released into the air. People get valley fever by inhaling the tiny spores.
Climate change has led to an increased incidence of drought and conditions supportive of coccidioidomycosis, and rates of valley fever are on the rise.
Groups at a higher risk of infection include people with weakened immune systems. Some occupations are more likely to get valley fever due to the increased exposure to dust. Farmers, road or construction workers, military personnel, as well as loggers.
The symptoms are similar to the flu. Chest radiography should be performed in all patients in whom coccidioidomycosis is suspected or confirmed, due to possibility of pulmonary infection. Waiting too long for appropriate treatment can lead to disseminated coccidioidomycosis. People with compromised immune systems are also prone to developing this complication. Awareness is key to avoid misdiagnosis, unnecessary anxiety, and costs of unrelated treatment plans. Coccidioidomycosis often goes away on its own, although some will need to take antifungal medications to help. Although it's a rare disease, valley fever is on the rise and will continue to rise and spread due to an increase in dry environments, a result of climate change.
I know valley fever is not contagious, but what are the policies around valley fever prevention? I don't want to get it.
Many states have recommendations on how to avoid valley fever in the workplace. Follow these recommendations. They are listed in the next slide.
Talk to your doctor if you have flu-like symptoms that won't go away.
I'm going to prescribe you antifungal medication that you will take for 3 to 6 months.
Medical providers should understand the symptoms and public health effects of valley fever. There is no vaccine, so awareness and early detection are imperative.